Hey guys, so I have totally gone down the AI documentation rabbit hole. I've been spending the last couple weeks now, probably trying to figure this out, trying to understand where, this helps us, where they're going in the right direction, where they're going in the wrong direction. And I've got some observations that I want to share with you guys. But I want this to be kind of a two-way communication. I want you to provide me with feedback, with information. Have you tried any kind of AI documentation? What are your thoughts? What worked? What didn't work? And then I think collectively we can help the developers better understand what it is that we need as treating therapists in the clinic. So, couple observations right off the bat. Most of the systems that I see today, what they're doing is they're recording the audio between a patient and therapist engagement. Then they're trying to take that audio and paraphrase it into usable documentation, typically a SOAP note format or something like that. Now, a couple of the problems. So we all use different EMRs. We all have different methods of documenting. I'm realizing that as I record the audio from patient treatments or from evaluations, there's a lot that I don't say, I don't verbalize. And if I don't verbalize it, the AI can't process it. So I'm doing a lot of kind of back and forth. And for my practice, now I'm primarily outpatient orthopedic. I love a busy practice. I love lots of people, lots of engagement. Today, for example, Fridays, I work a half day. I'll have 6 or 7 people in the clinic with me. Some are patients, some are non-covered wellness, non-covered maintenance individuals. Some are friends and family of patients. And we're all talking, and we're all having fun, and we're talking about the weather and current affairs and projects that we're doing around the house. I might be saying to a person who's on a non-covered maintenance program, go ahead and give this a try and do these things and this many reps and this many sets, while I'm still working with a patient. And so it's really hard for the AI to understand what I'm saying and who I am saying it to. I also noticed that as we converse, my patient and I, the people in the clinic, I don't want to have to say everything. I don't want to verbalize everything. I do range of motion measurements. I might have 5 or 6 range of motion measurements in my head. I don't want to have to say every one. Normally, I would just go and drop them into the system. So there are limitations to the technology right now, like it can't read my brain, can't read my thoughts. But I'm also finding that a more comfortable way for me to use this current technology is in the format of a dictation rather than a passive audio capture. So in other words, I might complete a patient care daily treatment, and then I'll dictate into my phone or into the computer exactly what we did, the response to therapy. I'll dictate all the requirements for a treatment note. But there are certain requirements. For example, United Healthcare now requires time in, time out in a treatment note, where Medicare Part B doesn't require time in, time out, but it requires total treatment time in minutes. So each third-party payer has specific guidelines and nuances to what it requires. And what I'm thinking is, rather than AI just writing the notes for me based on what it hears, I think AI should be more of a companion. AI should be my internal auditor, so that I dictate a treatment note, I dictate an evaluation, I dictate a progress report. The AI will process that. It will generate its own version of what I dictated, but then it'll prompt me with additional questions. So as the example I just gave, if it was a United Healthcare daily treatment note and I didn't give it time in, time out, AI would recognize, because it would have been trained on United Healthcare documentation requirements, and it would say, thank you so much for all the great information. Can you tell me when the patient started therapy and when the patient completed therapy today? And I would say, the patient started at 8:05 a.m. and we completed the session at 8:37 a.m. Medicare, for a progress report, it requires you indicate the reporting period coverage dates. So when did the reporting period start? When did the reporting period end? The AI should recognize if I didn't verbalize, this is a progress report, the progress reporting period began on this date and this date, the AI would prompt me to deliver that information. In evaluations, Medicare has pretty specific guidelines on what it requires for justification to utilize CPT codes like 97110, 97140, 97530. If the AI processes the original, let's call it a rough draft of the initial evaluation, but doesn't have the required elements based on Medicare published guidelines, then it would prompt me with questions to collect that information to make it a fully compliant note. That's what I want to see. That's where I think this needs to go. That's where I think it adds enough value. Saving me 2 or 3 minutes of time per treatment note, I don't think it's going to make a difference. But guaranteeing me, or at least reassuring me, that my treatment note is compliant with published guidelines, that I've provided enough information that my human brain didn't forget 1 or 2 details that are required elements, that's where I think the real value is. And depending on how deep this goes, I often request comparative billing reports so I can see my utilization of certain procedure codes, CPT codes, compared to my peers. And if I'm way off the chart, I know that I have an increased risk of potential Medicare audit. AI would be able to recognize that. AI would be able to process my comparative billing report, keep track of my utilization of certain CPT codes, look at, multiple cases and how I'm utilizing procedure codes based on those cases. All of that is possible. I don't think the technology is there today, but I think that's where it's going to go. But again, the purpose of AI for me is to be my expert compliance officer, to be my legal counsel, to do all of these things that I, as a small private practice, don't have the money to afford to hire all those professionals. But if I could lean on this computer system just a little bit, so that at least at the very minimum, it goes through the clinical checklist to make sure every documentation element has been satisfied with yes or no, that takes me 1,000 times further ahead from where I am today. So that's what I see. And then, of course, if you guys are still listening, we're at 7 minutes. I do think it's a powerful tool for students. DPT students, OT students, PTA, OTA students. I think that when a student's on a clinical rotation, we know one of the most challenging things is documentation, understanding documentation. So if a student could have an AI in his pocket, her pocket, where they dictate an initial treatment note, allow the AI to analyze it, the AI then prompts that student to provide the required elements that the student didn't even know were required, so that now they have a final product and that student can take that final product and put it into whatever EMR system that clinical site rotation is using. That is hugely powerful. And so I really think that there's opportunities for AI documentation in education. I think there's huge opportunities for AI documentation in compliance and protection. I want that suit of armor protecting me and my practice from the insurance company, because I'm sure the insurance company has AI on their side, analyzing all of the medical records at scale, identifying the deficiencies, bringing those deficiencies to the surface so that the auditors can then look at those deficiencies and dig deeper into why those accounts are deficient. I think AI offers that kind of protection.